Welcome back to Primetime News, and a special welcome if you're watching on onespotmedia.com. Up first this evening, another COVID-19 patient has died in Jamaica. This brings the total number of deaths to 3. As for the number of confirmed cases, that figure now stands at 44. The update was given at a virtual press briefing today. Andrea Chisholm was listening in and now joins us live. Andrea.
Herman, another press briefing with some sad news. Health Minister Dr. Christopher Tufton said the third COVID-19 patient that died is a 41-year-old male from Westmoreland, and he had a travel history from the United Kingdom.
He tested positive on March 23rd. He had some underlying conditions, and experienced renal failure, and regrettably passed away today, earlier this afternoon.
As for the second COVID-19 patient that died on Tuesday, that's yesterday, that case is still being investigated. The minister also made a correction, saying that the second death was a male and not a female as originally reported, still from St. Elizabeth with a travel history from Boston, Atlanta in the United States. Now, as we mentioned earlier, Jamaica now has 44 confirmed cases of COVID-19. 6 more cases were reported today.
All of the 6 positives are linked to the quarantine community in southeast Clarendon of Cornpeace. One of the 6, a 53-year-old male, had traveled with the index case, so has a travel history from New York. And you will recall that that index case was the first person, a 79-year-old male, to have passed based on the impact of the virus.
Chief Medical Officer Dr. Jacqueline Bisesa Mackenzie also pointed out that for Cornpeace settlement in Clarendon, which is still under quarantine, 50 households are being monitored. People in Longvale, Portland Cottage and Hayes, also in Clarendon, are also on the list.
For those 50 households, we have interviewed over 250 persons, and there have been about 30 persons that we have identified as close contacts to the first person that was positive and then the second related contact that was positive. So those persons have all been tested, and you will see that there is an increase in the numbers that you have seen in terms of 6 persons that are positive, that are really very close contacts of those persons. So that was an expectation. We expected that based on the level of contact that these persons had, that they would have been positive.
So where do we go from here? Dr. Tufton said by this weekend, mobile testing should begin.
The ministry will be essentially engaging mobile units, which will be branded to indicate their purpose. And those units will be deployed in parishes across the country. We're going to begin in the Southeast Regional Health Authority, SERA, and Northeast Regional Health Authority region. And there will be a protocol assigned to the deployment of those mobile units, where persons who have a desire to be tested would be subjected to that protocol in terms of an assessment done or triage, as would be done in an accident and emergency context. And if they meet the specific requirements or criteria, then the samples would be collected by those units and tests administered, and they'll be contacted and given appropriate counseling and guidance.
The minister emphasized, however, that even though people may volunteer for testing, it does not mean that their request will be granted. It would be based on the clinical assessment similar to triage by the health authorities. And another reminder for persons who came into the island since March 18, please make contact with the health ministry. If you fail to do so, you may just face a hefty fine because the authorities are tracking those persons who have not reported. Herman?
All right, thank you, Andrea. That report there from Andrea Chisholm, a virtual press briefing from the Ministry of Health.